What's going on, everyone? Tom Walters from Rehab Science back here again. Do you have pain along the front of your shin in this area, maybe with running or playing soccer? If you do, that's exactly what we're going to discuss today. We're going to talk about anterior shin splints, which just means shin splints on the front of the leg. A lot of times this happens with running, so if you've got that kind of pain, I'm going to show you 3 exercises to help get rid of it, so let's jump into it. So when we're thinking about shin splints, there are basically 2 types. There's an anterior shin splint, which is this muscle sort of on the front of the shin. It can affect the bone and this muscle, tibialis anterior. There can also be posterior shin splints, which are on the back side of the tibia, and I'll cover that in another post. So for today, we're going to talk about this front side. You can see when I pull my foot up, this muscle right here that squeezes, this is tibialis anterior. It comes down, it has this big tendon on the top of your foot, so it lifts your foot. It's used heavily when running, especially as you hit the ground with your heel. That muscle helps to slow your foot down so it doesn't just slap the ground. So in people who are running a lot, maybe running downhill, this muscle works a ton. It can become strained and can turn into shin splints. So we're really going to focus on this tibialis anterior muscle. If we look at the research on an issue like this, it can be really helpful to release the muscle, but then really we want to focus on strengthening this muscle and strengthening this tendon in combination with figuring out what's happening in our sport and in life that might be aggravating it. So a big piece is figuring out, do I need to dial back my running temporarily to let this calm down? And then adding in the strength training to build up the strength of the muscle and tendon. So we're going to look at 3 different movements that'll basically help release it, reduce pain, and then build strength. So let's get into the first exercise. All right, so for the first movement, we are going to work on releasing the tibialis anterior muscle. So you want to grab a foam roller. I've got a nice one of these little short ones. These are easy just to find on Amazon. You're just going to place it down, and then I'm thinking about this muscle. I don't want to foam roll the bone right here. I want to do the muscle, which is just to the side, this big tibialis anterior muscle. So I'm going to set that on the roller and kind of brace with my arms, and then just roll back and forth, and you'll find tender spots all along that muscle. So just kind of go back and forth. When you find a tender spot, kind of pause on it, take a few deep breaths, and then keep moving. And what I want you to do is try and do this every day and spend, somewhere around 1 to 3 minutes rolling this muscle. It'll help release it and help to reduce pain. For this second exercise, we are going to stretch the tibialis anterior muscle. So to do this, you've basically got to put your foot almost in the exact opposite position you'd use to stretch your calf. So what we're going to do is put the top of the foot, kind of laces part of your foot, on the ground, like you're pointing your foot, sort of like a ballerina. That's going to go into the ground. Then you're going to straighten your knee. Sometimes it helps also to kind of turn your ankle in and then pull away. And so as you hold it there, you should get a stretch sort of across this top side in that tibialis anterior muscle. So put that foot down, kind of turn in, straighten the knee, see if you can get a stretch to help relieve discomfort in that muscle. With stretches, we want to do 2 to 4 repetitions and hold for 15 to 30 seconds every day. The third exercise is our last one. It's the one that's the most important. The first 2 are really just there to help reduce discomfort. If you want to help prevent this condition from coming back permanently, we have to strengthen that tibialis anterior muscle and its tendon. So you want to get a loop band like this. Again, these are just really easy to order online. You're going to put it on the tops of your feet up by your toes, and then the leg that has the pain, I'm going to bend that hip and knee and hold back behind on my hamstring area. And then what I'm going to do, that band wants to snap my foot forward, so I'm going to let it pull my foot forward slightly, and then squeeze and pull back up into ankle dorsiflexion, which makes this tibialis anterior muscle work. And then slowly back out, and then pull back up again. I'm going to go back and forth like that slowly to strengthen this muscle. You can get the band, buy them by different colors to determine which one you need based on how strong you are. So just find the appropriate band, and then you're going to shoot for 3 sets of 8 to 12 repetitions, and you really want to pick a band that's strong enough that you feel strong fatigue in this tibialis anterior muscle as you get up close to 10 repetitions. So it's back and forth like that, build up the capacity and strength of that muscle, and that will help prevent this condition from coming back. So those are our 3 exercises. We've got a myofascial release with the foam roller, a stretch, and then a strengthening exercise with the band. Putting those 3 in will help get rid of shin splints and help prevent them from coming back. All right, you guys, see you next time.